Hi. So, May is Ehlers-Danlos Awareness Month. Ehlers-Danlos Syndrome and Hypermobility Spectrum Disorder Awareness Month. So, EDS and HSD Awareness Month. There are many types of EDS, and HSD is part of that spectrum as well. The diagnostic criteria changed a few years ago, so yeah, I won't get into that exactly, but the way EDS affects me, and I have the most common type, so I have the hypermobile type, which is not rare, except the way it affects me is maybe different than how it affects some other people. And the reason I feel like this disorder needs more awareness is because I have personally had a really hard time with the medical system, and I live in Ontario, Canada, and I went out of country for my spinal fusion. That was in 2014, and it helped me a great deal, but we are paying for it out of pocket still, my family. The Ontario government didn't cover it in any way, shape, or form. They covered one upright MRI after, a lot of begging basically and filling out forms and red tape. They did cover one test pre-surgery. They didn't cover my travel. They covered part of it. Anyway, it's complicated, but the surgery itself was the cost of a nice home, and it is a monthly fee still to pay off for, anyway, that's just how it is. So EDS is not well understood where I live, and I still don't have doctors that understand it. I want to say at all. I have a neuro-ophthalmologist who understands how it affects my eyes, and he is a godsend, but he's retiring soon. I think I have some other specialists. Oh yeah, my ENT isn't bad. He doesn't understand EDS that well, but he understands I had Ramsay-Hunt syndrome, probably, which is related to shingles, is related to immune problems, maybe. So that was my MS onset, my Ramsay-Hunt syndrome. So I'm getting off track, but I also have MS. And I found out I have MS as well about 2 years ago. And so my brain surgery for my cranial vertebral instability and my Chiari brain malformation, that was 6 years ago. So things have been, there hasn't really been a lot of stability for me. I mean, over the past couple years, things have been pretty stable, honestly. But I think I've been 100% prioritizing my health, and I totally fear going back to any kind of way of life where I do anything other than that. When I came down with MS for the first time, sorry, I hear something. I get paranoid about people listening to me. It's just my neighbor. So my Ehlers-Danlos syndrome is my genetic disorder I was born with, and everything else I have, in my opinion, in my experience, in my anecdotal experience, is branched off from that, has branched off from my genetic disorder, is a result of my genetic disorder and how it's run its course. So I'm not saying everyone with hypermobile EDS is prone to getting MS. Probably not. Probably that's very unusual, but I wonder what the correlation is. I wonder if there's a correlation, because that's been the latest stage in the, progression of things, is relapsing remitting MS. But relapsing remitting MS with serious, I have souvenirs is what my neurologist says. So when my face went numb, I still have this feeling in my face, like I'm missing feeling in my face. I have that in my hand as well. I have that in both my legs. My optic neuritis eye is still a little funny. My double vision eye is still a little funny. You know, we just live like this now. That's just how it is. The tip of my tongue is always numb. It gets tiring. I got ringing in my ears all the time, but I wear hearing aids now, and that really helps with that. The only reason I could get the hearing aids covered is because I have a mild degree of hearing loss, because that is from otosclerosis, which is the type, it's not actually otosclerosis. It looks like otosclerosis, but if you have hypermobile EDS, it isn't true otosclerosis. No one knows what this is, but it's a problem you can have with your inner ear where they calcify or ossify or whatever. And with me, the little hammer and anvil and all those parts in there, they're hypermobile. So that's why I have the low tone hearing loss. So it manifests like something else, but the treatment for that would be surgery, whereas if they did that to me, they would ruin my hearing completely. So, you know, you have to be aware of your disorder, of your underlying genetic disorder. I do with my doctors, because they don't know, you know. They just aren't educated about it, and it's sad, and that's why my health is so precarious. I mean, I do everything I can, and I have an MS specialist now, but I don't have any other neurologist, so my neurologist has no idea what the hell is going on with me. Like, she just thinks EDS is like fibromyalgia, and it's not, and fibromyalgia can be like a symptom of EDS, like a secondary condition, but I even don't like that, because my understanding of fibromyalgia was always muscle and joint pain of unknown origin, but we know the origin. I'm having subluxations 50, 60, 100, 200 times a day. I'm, you know, the collagen that makes up my body is missing a component, so that is why my body is working extra hard and to compensate for it. So I don't think it makes sense to call it fibromyalgia or call fibromyalgia part of it. Like, yes, there's a lot of pain. It's completely just pain all day, all the time, all night, all day. That's just it. That's just my life. I just live in pain. I'm in pain. Pretty bad pain all the time. I don't even like the pain scale. I don't know how I would rate my pain on the pain scale. It comes and goes in severity, but it never goes away. And I have a lot of burning pain in my neck and shoulders now. And it's inflammatory pain from the strain from my body trying to hold itself together. It's not like we don't know why it's there. I know why it's there. You know, I do things to mitigate it. I use lidocaine cream and I take cold showers. Helps, honestly, and yeah, I medicate in ways, but you know, stay away from opiates. Not everyone can, though. I meditate. Like, that's how I deal with it now. And it's funny because when I first developed chronic pain, I couldn't meditate. I couldn't meditate to save my life. I was meditating all the time until my onset, and then it was like every time I'd try, I'd just become so aware of my body that it would trigger me, and I would just cry, and so I couldn't work through it. So for years, I think I just, I was very dissociated, and I'm still dissociated a lot of the time, but I try really hard to be mindful now, and every day, and that's the way I'm making it through this global pandemic, and the way it's affecting my life. I won't go into detail, I guess, but you know, you can imagine. It's how I deal with feeling totally isolated, like aside from, yes, there's a pandemic and that's isolating, but I was already really isolated, so I'm like probably more isolated now, but I'm kind of coming to terms with it, and I am finding community online in a way that I haven't really before, and it's not, yes, I find some connections in the chronic illness community, but lately it's been the spiritual community that I've been gravitating towards, and the doll community, the doll collector community, and the reborn community. A lot of those people have chronic illness and autoimmune illness, interestingly. I think just because we need therapy, and honoring the inner child is really important, you know. especially when you live like this. It's just, you have to take care of that little person inside of you. Anyway, I don't know if I'm getting too deep. I just want to say, this is not fibromyalgia. Okay? Like, sure, that can be part of it, but that's not what it is. This is a collagen disorder where you're missing part of your DNA. So it's a body type. So I look at it as being a body type. And in my case, it needed some surgical repair because, I don't know, I was in yoga doing shoulder stands. I think I ruined my neck, but I don't think everyone should be doing shoulder stands. There's probably, I don't know how it happened, but I had cranial settling, so my head was falling down onto my neck. So that's why I needed the fusion. So this is nothing, it just happened. It's not, obviously that doesn't happen from just pain, right? It happens because things are not staying put as they should be. So many times a day, things for me click in and out of place, and I put them back myself. And I don't see doctors right now because we can't really, or therapists or my RMT or anything. So I'm just kind of out in the wilderness. But again, I'm sort of used to it, and it's not really that much different. And I'm actually enjoying not having the pressure to go out and sort of be normal and take part in things the way people expect you to. I stay home a lot. I walk the dog a lot. I garden on my balcony lately, and yeah, I don't really have much room for anything else. Like I take some nice big walks sometimes with my boyfriend. I got a walking bike. It's called a Linker. I just got it. I've used it twice. It's wonderful. So maybe I'll talk more about that. But it's sort of a mobility device and sort of rehab equipment and sort of a bike without pedals and 3 wheels. So sort of a trike. Anyway, this is just my thoughts. It's EDS Awareness Month. I want there to be more awareness of hEDS, hypermobile EDS, and the other thing, JHS. Is that what it's called? Oh man, brain fog. I'm sort of still getting used to the new terminology, even though it's been a couple of years, but there is an EDS clinic in Ontario now, but I haven't heard good things about it in regards to my condition, which is hypermobile EDS. I really haven't heard anything good yet. So I'm hoping though, but thanks for listening. Happy EDS Awareness Month. And I hope things get better for us. I really do. I still hope. It seems like they're getting worse. But, we find ways, I guess. Thanks. Take care of yourselves.